I haven't heard a bird chirp for, 20 years.
Today we've done our first adult cochlear implant surgery. It went incredibly well. Our patient was a typical 70-something-year-old patient who'd had a progressive hearing loss in both ears, to the point where hearing aids weren't working at all. In fact, she didn't even bring her hearing aids to theatre because she relies on lip reading now.
30 years ago, I just realised that I couldn't hear. I've given up driving. You can't hear the grandchildren. It's got worse in the last 5 years. Yeah.
It's been something that's been a long time coming, with a lot of help from various different parties. But today we're incredibly excited to announce the beginning of a cochlear implant program at Gold Coast University Hospital in our districts. 1 in 6 Australians have hearing loss of any form. In 2020, pre-COVID, there are over 4,000 people on the Gold Coast with severe hearing loss that could benefit from a cochlear implant. So it's probably more like 4,500 people now. There comes a point where hearing aids just don't amplify the sound anymore, they're just not hearing anything. And that's because the hair cells have degenerated for a whole variety of reasons. What this does is it goes one step beyond the hair cells to the nerve cells directly, which are usually intact and still working, and it stimulates them via this electrode. There's 2 components. There's the outside part, which is called the sound processor, that's worn like a hearing aid over the ear or even further back behind the ear. And then there's the implant itself, which sits under the skin, and that's what's surgically inserted into the patient. It can't be seen, but the patients can usually feel it just behind the ear. Previously, patients had to go to Brisbane to have the surgery, which is actually a lot more than just an hour's drive. The number of appointments are required, the difficulty in getting patients, particularly elderly, to CBD Brisbane for these appointments, for the surgery, post-operative care and switch on, it was just too much for honestly most of the patients we've had coming through our clinic. We've been allocated 10 adult patients per financial year. We're hoping over time that will grow as we establish the service and we demonstrate that it's working. The 2 big demographics will be newborn babies and the elderly, because as we grow, our hearing declines with age. When your hearing gets to a certain point, even with the best hearing aids you can get, you're missing out on conversations in noisy backgrounds such as restaurants, clubs, etc. People tend to withdraw. They isolate themselves, they don't go out as much. And when you do that, you're not challenging your brain, you're not living your best life. So this is a huge thing.
To be able to hear what people are saying, I haven't been able to join in a conversation for so long. If anybody offers it to you, go for it.